Rhode Island.
President, thank you very much. As I come to the floor, I reflect on how I've never understood what it is in the Republican mind that is so fixated on taking health care away from people. It really doesn't make sense. It may be some recessive political gene that goes back to when Republicans opposed Medicare, attacked it as socialized medicine, tried to make sure it never happened. But it really doesn't make sense. But it's active still. And Americans are looking at 3 waves of attack on their health care. The first wave is pulling their Affordable Care credits. That is a big deal for a lot of people. 24 million Americans are going to be affected, are going to see their costs for health care likely double. In Rhode Island, my small state, tens of thousands of people are going to be similarly affected. Huge increases in their monthly costs for the same health care. And because so many of them aren't going to be able to afford that increase, we estimate that 13,000 Rhode Islanders will lose their coverage and have to go to emergency rooms and wait in line and drive up the ultimate cost of care by not getting treatment when it's needed. But it's not just the Affordable Care credits that are imperiled here. Right behind that is a $500 billion cut to Medicare. Medicare. Some of us remember when President Biden gave his State of the Union, and he had a bit of an exchange with the Republicans in the House about Medicare. He said, you know, Republicans always are trying to cut Medicare. And they all jumped up out of their chairs, yelling and screaming, and said, no, 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 we'll never cut Medicare. We're not for that. You can't say we're for that. What did they do in the Beautiful for Billionaires bill? Cut Medicare. They did it a tricky way because they don't want to own that they are Medicare cutters. You saw that behavior during Biden's State of the Union. They do not want to own cutting Medicare. They know people like and respect Medicare and rely on Medicare. But the Beautiful for Billionaires bill, by virtue of adding over $4 trillion to our national debt, triggered another law, the sequestration law, that automatically imposes cuts on Medicare starting next year. Next year. And it's a $500 billion in Medicare cuts. So that's backed up behind the Affordable Care credits being pulled away. And then behind that comes the $1 trillion cut to Medicaid that was right on the face of the Beautiful for Billionaires bill. So you add those 3 things up. You pull the Affordable Care credits from the families that rely on it. You whack Medicare by $500 billion. You whack Medicaid by $1 trillion. You have delivered a devastating blow to the American people. Such a devastating blow, by the way, that the health care providers at the receiving end of those trillions of dollars are likely to suffer to the point of having to potentially close nursing homes, hospitals, provider practices, family doctors. They're the ones where this money ultimately lands, and when you take that much money away from our healthcare sector, don't think it's going to be okay, because it's not. So why do we stand and fight to protect the Affordable Care credits? Well, 2 reasons. One, because it is the first wave of this new Republican assault on Americans' health care. Affordable Care credits, then Medicare, then Medicaid. If we don't stand and fight now, with the Affordable Care credits being sent out now, the changes in the prices, then we're in no position to defend when the Medicare cuts come through, $500 billion, and when the Medicaid cuts come through, $1 trillion. And the second is, we can have some confidence that our Republican colleagues, when they get over this fixation about taking away Americans' health care, will realize that a lot of the Americans whose health care they're taking away are their own constituents. In fact, all the evidence is that these affordable care credits go more to Republican senators' constituents than they do to ours, which is why Republican House members running for re-election are writing letters saying, let's fix the affordable care credits. Let's extend affordable care credits for 2 years. That is why Republicans in this body are saying, yes, we know we need to negotiate to extend affordable care credits. We just don't want to do it right now. So we can have some confidence in this fight that Republicans' constituents are going to let them know how unwelcome pulling the Affordable Care Credits is. And that's before you even get to $500 billion cuts to Medicare and $1 trillion cuts to Medicaid. So this matters, and it matters to a lot of people. And it matters in Republican states. I just happened to pick Tennessee. Here's a little bit about what's going to happen in Tennessee. Tennessee families, thanks to Republicans not willing to negotiate with us, will see their premiums increase on average by 320% next year. 320%. More than 600,000 Tennesseans rely on the state affordable care marketplace, healthcare.gov, for their insurance. These families will pay, on average, $464 more for their health insurance. Here's some examples of how health insurance sticker shock is landing right now in Tennessee as the notices go out for the next enrollment period. A 45-year-old in Tennessee making $62,000, driving their own truck, working their small farm, operating their small business, will see their average annual premium costs rise by $1,726. A 60-year-old couple making $82,000 will see their average annual premium costs rise by $19,329. A quarter of their $82,000 income gone like that because Republicans won't sit down and negotiate like grown-ups. A family of four making $126,000 will see their average annual premium costs rise by $9,087. This just isn't going to work, my friends. You're going to have to figure this out. Otherwise, around 210,000 Tennesseans will go uninsured. And by the way, because the money flows through to the healthcare providers, providers in Tennessee will take the hit. They will lose an additional $1.3 billion in funding that supports healthcare in Tennessee. $1.3 billion, billion with a B. So it's time to fix this. Over and over again, Senate Republicans have said, yes, we're willing to negotiate. We just don't want to do it now. We want to do it later. So all of this pain, the damage the president is throwing on with his snap cuts, the damage Trump is throwing on by adding that he threatens to close American airspace. Believe it or not, this is a president who will close American airspace before he will help Americans get health care coverage. Think about that just for a moment. Let that thought land. Close American airspace rather than give Americans' health care coverage. And the fight, the gravamen of this dispute right now isn't over negotiating. It's over when to negotiate. Really? It's worth causing all this damage over when to negotiate? I would say you could negotiate right now, and we could come to an agreement within a week that would put an end to the continuing resolution, and we could go forward. There's one problem. I think President Trump doesn't want the shutdown to end. I think his creepy minion at the Office of Management and Budget, Russell Vought, doesn't want the shutdown to end. They like the shutdown. They look forward to the shutdown. They gave Gatsby parties at Mar-a-Lago during the shutdown. Everything about this shutdown thrills their dark hearts, and they could care less about Americans suffering. I yield the floor.